Hey guys, I'm Nicky, and if you're new here, welcome. So it has always been my intention to make another video of the non-doctors who help through internship. These persons are absolutely crucial, sometimes even more crucial to you than your doctor colleagues. And somebody also messaged me and said, "Oh, you should have made a non-doctor one as well." And here I am today. Hey guys, welcome back to Nicky at your Cervix. It's your girl Nicky here, and if you're new here, welcome. Don't forget to hit my subscribe button, turn my post notification bell on so you can get an update every time I have a new release. And follow me on Instagram at Nicky _at your _cervix for lots more interesting content. It's important to note that a hospital is a team. Doctors cannot run the hospital only. Nurses cannot run the hospital only. The hospital is run as a team from doctors, nurses, PCAs, orderlies, customer service workers, lab technicians, and all them things. These are all important in running the hospital. It's important to note, as an intern, some of the time you're the only one that's left on the ward. So you are basically in charge of everything. You are in charge of the administrative work. You are in charge of most things because you're the only one there. I just want to shout out to my favorite clerks. Who are the clerks? The clerks are the persons who pull the dockets for you because you cannot see a patient without their medical record. If we have no clerks, we have no docket and we have no hospital. So they are very important. My favorite clerks, or the most helpful clerks for me in my journey, I'm going to start off with my clerk on pediatrics, is Miss Tricia Goldsmith. Miss Goldsmith, chef kiss. Very helpful, very respectful, and she does her work to the T. Thank you so much, Tricia. She didn't even just be a clerk. We became friends. We became good support system to each other, and that is so important. Another clerk that helped the most, I was on female surgical at the time, was Miss Liscombe. I believe her first name is Miss Chevel Liscombe. Miss Liscombe also very respectful, very hardworking. And if you say Miss Liscombe, I don't see the dockets for the word reviews, Miss Liscombe will say, Brian, you're not looking because you pull all the word review dockets over here. I'm like, okay, Miss Liscombe, sorry about that, my love, sorry about that. And they're always organized and ready. Another clerk that helped me, I was on male surgical at this time, was Miss Brown. Miss Brown, another chef kiss. Miss Brown was so respectful, so helpful, and Miss Brown don't run for tell what he say. Hello, Brian, me have two discharge summary for you, So, me have to sort them out for me before you left. I was like, alright, Miss Brown, I got you. But as I said, if you want a record to be pulled, if you want anything as regards to them things, copying things, getting results, your clerks are there to help you. Their majority are respectful, they're nice, and they're willing to help. Make sure you're doing the discharge summaries, and they will be reminding you guys, they will be writing your name at the Dr. Brian discharge summary. I said, don't worry yourself, man. I'm going to clear it out because me I love to see my name and things undone. Because I hate to see Dr. Brian unfinished discharge. So I'm going to do it quick. Because my shame bad. Another thing as intern that you do are your blood transfusion. You drop off samples at the lab. So you call them to get information on lab results, the readiness of the blood. One, if the patient needs to go to dialysis, the patient needs to go with 2 bags of blood. So you have to be in contact with the lab as regards to these important things, and you, the intern, have to be the one to do it. So I just want to shout out 2 people at the lab. The first one is Mr. Shavar Knight. Mr. Knight, I'd call Mr. Knight and say, Mr. Knight, me have a patient in HbF4 and boy, symptomatic anemia and him badly needs some blood. And we'll tell them the story of the patient and they'll say, okay, I'm going to sort out something for you. Did you drop off a red top or purple top for the patient and so on. But Mr. Knight has always been respectful. Mr. Knight has always been helpful towards me as regards to giving me the blood results and so on. So it's like a teamwork per se. Another person is Miss Williams. Miss Williams, whenever Miss Williams sees me coming in the lab, Miss Williams just say, Brian, we don't no blood. And then me just say, Miss Williams, you know, me come for Joshua Jones blood, and she said, alright, we prepare 2 units feet, sit here. And that's the relationship we have. Another important set of persons are your PCAs, patient care assistants. These help the patient. They're the one who feed the patient who can't feed themselves. They clean the patient, among many other things. They source resources for the ward. So as I said before, they are important part. And very important PCA to my well-being as an intern is Miss Haynes. Miss Haynes is so respectful. Miss Haynes would be the one say, Brian, you know, so you don't look like you eat from morning. Go and stop. Take 5 minutes and eat something and go back on the work. Because some of the time I don't even remember to eat. And Miss Haynes is reminding me. Miss Haynes, you have PCs who also goes on the ambulance to bring the patient to the scan. So you have to be in contact with them as the intern because they're the one who organize the transport for the scan and the ambulance. So when you book your patients, the PCs are the one who carry them if they're not so critical patients. If it's a very critical patient, a nurse or a doctor has to go with them. And Miss Haynes, chef kiss. Another PCA that was very important in my well-being is also Miss Brown. Miss Brown was once a clerk and then she studied PCA and no, she's now a PCA. Miss Brown is very helpful and very respectful just the same. Another important set of people are your customer service people. I'm telling you. When you have EHCHD form to fill out, these are the forms to let their patients get their scans and so on. You go to customer care. So customer care people are basically your best friends. Because when you're on surgery or you're on medicine, everybody need a brain scan. Everybody need a CT abdomen. Everybody need an abdominal ultrasound. Them always need it. So if you fill out these forms are very tedious sometimes because you have to authorize the form, then your consultant authorize it, then the SMO have to authorize it, then it gets stamped by customer service. So it goes through a whole process. There's a whole lot of rundown to get these form approved. And I have to give shout out to 3 persons at customer service. They were very helpful. Is Mr. Jonathan Bintz. When Mr. Bintz sees me come in, the only thing he said, oh, you want one form? So, as I said, a lot of administrative work is in internship. Another one is Mr. Ronaldo Reed. So, Mr. Reed and I would be like, Mr. Ronaldo, I never know, sir, Ronaldo, your first name, because we're on first name basis. Because I'm like, I'm Nicky. And they're like, Ronaldo, my name. And I say, but And I say, so you have them a big name, yeah, you a baller. I must say, yeah man, me a baller man. And so anytime they see me coming, they know say, farm down. Alright. Susan the third feel. And Miss Shakira Duncan. Miss Duncan was also very helpful, very respectful and everything. When you come down there, say, can I get a form please? Make sure you go down there to the customer service people with the patient's name and reg number because they're not going to give you the forms without it. So another person is Sharmisha as well. I can't remember her last name, but apologies for saying your first name like that only. But you guys were so helpful and it makes the process way smoother when you go down there. Them know say you want the form because they have to go say, alright, me have 16 blood to take off over the lab. Alright, me have 4 form to collect. It can be very tedious. So when you go down there, what I do is just write a little paper with the patient name and reg number and the type of scan I want them to do, and I just push it under the window and say, sort out this for me because this is what I want, and then they just sort it out for me, and in 5 minutes I'm out of there. And lastly, I'll be shouting out to the nurses who were so crucial and helpful throughout my internship program. Listen to me, let me tell you something. Your nurses are your colleagues and your best friends. Your nurses are who stays on the ward, when you are running up and down doing everything, they are the one who is around the patient 24/7. So you and your nurses have to have a good relationship. It don't mean to say you guys have to be best friends. It means that you guys have to have a good professional relationship. I just want to start with ONG. When I was on ONG, I believe the nurse who helped me the most was Sister Davis. Sister Davis is pretty cool. Sister Davis would see me and say, is that Brian I see? Anything you're doing, Sister Davis would be like, is that Brian I see collecting blood? Wait, is that Brian I see resting? Wait a minute, is that Brian I see sitting down there and there are ward reviews to be done? That is Sister Davis. This relationship is extremely important, so it's important to be respectful. So, another set of nurses who helped me on ONG was, I believe, Nurse Pinnock, Nurse Authors, Nurse Archery is now on ONG, because nurses rotate just the same, and they were very crucial in helping me. So just like how we rotate, the nurses rotate. And when I rotated to surgery, when I was on male surgical ward, I got a lot of help from the nurses. Because surgery can be hectic at times. Because one moment everything is fine, and the next moment they hear there's a mass casualty, a big bus crash. Everything is packed on male surgical or female surgical ward. So it can go 0 to 100 real quick. So they are very crucial. The nurses who helped me the most are Nurse Dillon. Shout out to Nurse Dillon. Very respectful, very helpful. Nurse Taylor. Very respectful, very helpful, just the same. And Nurse Malcolm Rose. I remember when I was doing a UCAT for a patient, the patient wasn't very compliant. And because interns are the one who does male UCAT. If it's a female UCAT, the nurses does it. The nurses do it. But if it's a male UCAT to be passed, it's only doctors can do that one. So I was doing the male UCAT. The patient wasn't very compliant, and I said, Nurse Rose, this was like 3 o'clock in the morning. Nurse Rose, can you assist me with this patient, passing this UCAT as regards to holding this stuff and so on? And Nurse Rose was like, Nurse Malcolm Rose was like, not a problem, of course. Like, she's like, why are you even asking? I'm going to help you anyways. So we went there, and she was there talking to the patient, counseling the patient to give me a chance to do it. It's late in the night, and we had this stuff because you have to get sterile to put past a UCAT. Got sterile, and she'd drop my stuff in the sterile field. If I want something, she'd pass it for me, and we had to do urine culture just the same for the patient, and she was very helpful through that. And from that day, I just look at her differently. Like, this was 3 o'clock in the morning, and she has her nurse work to do as much as we have our doctor work to do. And she stopped and she helped me to pass this UCAT because it's not her job. But as I said before, the assistance was so important and so crucial. I also met another nurse, Nurse Hannon, on surgery. I was on male surgical at the time. Nurse Hannon is somebody you can ask about anything. You can say, Nurse, where I can find this? Nurse, what you think about this? Or did this patient go for this scan? And Nurse Hannon would know. She's very respectful, very helpful, and was a crucial part of the journey. I'm telling you, your nurses are very important. Another nurse I met on male surgical, if I can recall, was Nurse Adama Wright. Nurse Wright was another chef kiss. Nurse Wright advocates for her patients, and Nurse Wright would call me and say, Brian, I have a patient. The patient is on a Lasix infusion, or the patient is having a temperature. I'm advocating for the patient to get some fever medication like Baralgin and so on. I'm like, all right, my dear, I'm coming. Don't worry. I'm coming to give your patient some Baralgin. I'm coming to give your patient some Cetamol. I'm coming to start that Lasix infusion for your patient. Nurse Wright, chef kiss. She's very passionate about her work, very passionate about the things she does, and that's very important. Chef kiss. For my last rotation, I started medicine. I started male medicine. When I went to male medicine ward, the nurses and the staffs were very welcoming to me.
Sister Brown, I have to shout out Sister Brown. I can go to Sister Brown with any issues that I'm having, and Sister Brown will sort it out in a very calm, nice way. Sister Brown is like, Dr. Brian, how are you doing today? Why do you look so stressed? And when I told her I was leaving, she's like, oh, Dr. Brian, I'm going to miss you. That's how Sister Brown talks in a very calm way. And that's also crucial because sometimes it's not what you say, how you say stuff. Sister Brown, very crucial. Love her voice. On the same page as male medicine, I also want to shout out to Nurse Tate. Nurse Tate does the graveyard shift when she was on that rotation when I'm on. And because we do graveyard shift all the time, our duty is a 32-hour shift. So we come 8 in the morning, like say we come 8 o'clock today, we don't go home until 4 o'clock tomorrow evening. So it's a 32-hour shift. So we are always doing graveyard shifts. But Nurse State was assigned to the graveyard shift, and it's always me and Nurse State. Nurse State calling me 2 o'clock in the morning. Brian, so and so, so and so, so and so. I mean, and she'd be like, I just always me and you in a this done. And I say, yes, I'm me and you, Nurse State again. Nurse State was very respectful, very helpful. Nurse State knows the information about her patients, and Nurse State will always be advocating for her patients. As I said, it's so crucial. Did I even say it's crucial to make sure you have a good relationship with your nurses? Did I say that? If I didn't say that, or if I said it 3 million times, I'm going to say it 3,000,001. It's important to have a good relationship with your nurses. And then the final place that I did my rotation was on the female medical ward. And I have to shout out to the female medical ward team of nurses. Quite a few of them were very helpful and very respectful. And I have to shout out to Nurse Francis. Nurse Francis was very crucial. Nurse Francis Nurse Francis could read out the diagnosis for her patient for you. Nurse Francis knows everything about her patient. Nurse Francis, chef kiss. Another nurse on female medical that's also important in the same regard is Nurse Rodney. Nurse Rodney knows her patient to the T. Nurse Rodney, just like how we have a to-do list, Nurse Rodney have our to-do list. Nurse Rodney have our to-do list. We say, alright, this patient need a UCAT. Alright, this patient need our fluid. Alright, this patient need this. We make sure cover everything for my patient then before me left off of my shift. That's Nurse Rodney. Chef kiss. Another very important nurse was also Nurse Patterson. Nurse Patterson is always respectful. She takes good care of her patients and she's respectful. Nurse Patterson would be like, when she calls on the phone and she's like, Bran, you know my voice by now. I say, yes, Nurse Patterson, I know it's you. And then she'd tell me her list of complaints and what she's advocating for. Very, very important. Another important nurse is Nurse Green. Nurse Green is respectful to her patients, is respectful to you, and she is going to get her work done. She is going to get her work done. And the last person I can recall at this specific time that was very crucial is Nurse Pearson. Nurse Pierce would be like, Brian, the patient blood pressure is low, so I'm advocating to bolus in her a liter of fluid and I'm going to recheck it. And like, yes, Nurse Pierce. Brian, this patient, you know that we don't give labetalol until he reach a specific BP, and the patient BP is now so and so, so and so. So I administered IV labetalol, so I'm informing you of same about the blood pressure spike. Very, very crucial. Be respectful at all times and make sure say you guys don't have to be friends. Just make sure so the professional relationship is there and the best interest at heart is the patient. You're advocating for the patient. You're doing things for your patient. No matter who you are in a malice, you are doing things for the patient. That's the main priority. And the oath that you took was to do no harm. And all of this is going to make things way smoother for you. So as I said before, I wish you guys all the best. And if you have any other requests, you can let me know.